Ophthalmic manifestation in COVID-19. Outlines of this topic include background, pathogenesis, prevalence of ophthalmic symptoms in COVID-19 patients, ophthalmic manifestation in COVID-19, investigation which can be done for these patients, treatment according to presentation, and lastly, how to protect ophthalmologists from infection. Background: severe acute respiratory syndrome, which is called SARS-CoV-2, has emerged in China in Wuhan City in 2019. Then, WHO has declared this disease as a global pandemic. The disease transmitted mainly through droplet infection by coughing or sneezing. The disease presented mainly by fever, dry cough, dyspnea, and pulmonary infiltration in chest imaging. The main diagnosis done by nasopharyngeal swab by PCR to detect single-strand RNA virus. Pathogenesis of the disease depend on two mechanisms: immune-mediated tissue damage and COVID-19 associated coagulopathy. Immune-mediated tissue damage occurs by binding of the viral spikes to angiotensin-converting enzyme to receptors. These receptors are located heavily in lung, heart, kidneys, intestinal tissue, and ocular tissue in corneal and conjunctival epithelium. This binding will activate a T lymphocytic-mediated tissue damage. COVID-associated maculopathy characterized mainly by thrombosis more than hemorrhage. It caused mainly by vascular endothelial dysfunction due to binding of the virus to the ACE2 receptor in the vascular endothelium. Also, there is elevated levels of fibrinogen. Eye as a gateway for infection. It has been proved that respiratory infection can occur through the eye in a Spanish influenza pandemic which occurred in 1918. This route of transmission is greatly underestimated in COVID-19 infection. The transmission of infection occurs by binding of the virus to ACE2 receptors in the conjunctival and corneal epithelial cells and in superficial T film. It has been proved that eye can be a source of infection by viral shedding in conjunctival secretions and tears, which has been proved by different studies. Prevalence of ophthalmic symptoms in COVID. Different studies try to answer this question. One study shows that it's about 4.3% ophthalmic symptoms occur in COVID-19 patients, and 0.9% ophthalmic symptoms were an initial symptoms. Another study shows that conjunctivitis occur in 8% of cases of COVID-19 patients. Third study shows that the prevalence of ophthalmic symptoms in COVID-19 patients vary from 2 to 32%. Ophthalmic manifestation in COVID-19 patients can be categorized into anterior segment manifestation, posterior segment manifestation, new ophthalmic manifestation, and lastly orbital manifestation. Anterior segment manifestation mainly presented by follicular conjunctivitis, which is the most common presentation on ophthalmic symptoms in COVID-19 patients. It can occur initially or can delayed in onset. Another important presentation is keratoconjunctivitis, characterized by photophobia, lacrimation, and conjunctival injection. This presentation can occur initially or in relapsing keratoconjunctivitis. Hemorrhagic and pseudomembranous conjunctivitis has been reported also in COVID-19 patients, and conjunctival injection or congestion is one of the presentation of ophthalmic symptoms in COVID-19 patients. Episcleritis is also reported in COVID-19 patients. dry eye and blepharitis, which correlated with the duration of the disease. Visual segment manifestation can occur by different mechanisms, mainly by vascular, inflammatory, and neural change triggered by the virus. It can cause vascular occlusions, retinal abnormalities, and uveal abnormalities. Vascular occlusion occur due to the precoagulant state caused by the virus. This precoagulant state causes vascular occlusion in the form of central retinal artery or central retinal vein occlusion, or even bilateral central retinal vein has been reported. Acute macular neuropathy and paracentral acute middle maculopathy also has been reported in COVID-19 patients. Retinal abnormalities can include vitritis, acute retinal necrosis, peripheral retinal hemorrhage, and macular hyperpigmentation. Serpiginous choroiditis, one of the uveal abnormalities which has been reported in young, healthy women. New ophthalmic manifestation is not a common presentation in COVID-19 patients. It can include papillitis, papillophlebitis, ED, stonic pupil, neurogenic ptosis, and cranial nerve pulses. Orbital manifestation variable from just retroorbital pain, acute dacoadenitis, orbital solitis and sinusitis caused by pulmonary congestion and second bacterial infection, and lastly the life-threatening infection of mucormycosis. Mucormycosis is a opportunistic infection caused by environmental molds, occurred due to immunocompromisation in patients of COVID-19 due to heavy steroid therapy. This infection is life-threatening with high mortality rate, so early diagnosis, high index of suspicion, and early treatment is mandatory to improve survival. The diagnosis of COVID patient should include detect the virus itself by PCR through nasopharyngeal swab and by chest CT, and then diagnosis of the ophthalmic manifestation can include fluorescein angiography, OCT, and CT orbit and paranasal sinuses. Treatment according to the presentation, conjunctivitis can be treated by lubricant and antibiotics. Keratoconjunctivitis treated as herpetic keratoconjunctivitis, pseudomembranous conjunctivitis treated by the debridement of these pseudomembranous and topical antibiotic and steroids. Vascular occlusion can be treated by anti-VEGF and prophylaxis by anticoagulant, and mucormycosis treated by antifungal and endoscopic sinus debridement and even orbital excentuation. Ophthalmologist should protect himself by the following guidelines proposed by American Academy of Ophthalmology, which include wearing N95% mask for the doctor, and the patient should wear surgical mask, use plastic shields on slit lamp, instruct the patient not to speak during slit lamp examination. Doctor can wear gloves and gowns and protective eye goggles. In summary, due to variability of manifestation in COVID-19, every physician should know this manifestation. The mechanism of pathogenesis of COVID-19 include immune-mediated damage and COVID-19 associated coagulopathy. Conjunctivitis is the most common presentation of ophthalmic symptoms in COVID. Another presentation is posterior segment manifestation, new ophthalmic manifestation, and orbital manifestation. Mucormycosis is a fatal disease which should be early treated and diagnosed to improve survival. Thank you and stay safe. Thank you very much.